All right, Ralph Havens here, physical therapist, Bellingham, Washington, and this is video number 3 in our series of self-treatment for runners and walkers and anybody else that has any kind of chronic pain, shoulders, hips, knees, backs, necks. It's a way to use an integrative approach to do some self-treatment and get some relief. So I encourage you to walk around before and after, and then do this simple exercise, and then walk around before and after again, and notice what's different. Now this one is very powerful. It's an integrative approach. We combine a few different methods. Message me if you have any questions, ralph@ralphhavens.com. You can find this on the blog, ralphhavens.com, and look for the blog. And I'll also put links for the other videos in the description. So here we go. So hopefully you've tested your mobility, you've walked around, you've run a little bit before and after, and you tested this. This is a technique that works on this area of your body. So we have a lot of structures right here. We have your diaphragm, and we have your liver, and we have your stomach, and we have the spleen, and we have the pancreas, and we have the kidneys back there, and the adrenals. It's right below the heart and the lungs. This diaphragm area is very, very key. Very, very key to unlocking the restrictions that could be causing neck pain, back pain, shoulder limitations. You can think of, like, if something's tight here, it could limit your shoulder, or if it's tight like this, it could stop a hip from working very well. So we want to loosen this up and get this to function very well. And again, this is integrated from a lot of different approaches, or a few different approaches that I use. We're going to get right to it. So hopefully you watched the first video so you know this super light touch technique. We'll go over it right now. You got the soft neck and the very top of the breastbone. You're going to touch very lightly and direct a little pressure up. There you go. And then we can do a couple different ways. We're going to do it 2 different ways. You can touch your fingers to your belly button and also touch it, and then bring the little pressure up, but it's very light. And then we're going to slouch like a teenager. When you slouch, stay slouched and turn your body to the right, about 30 degrees, and then bend your body, let the left shoulder drop about 35 degrees, and hold that for about a minute. I'll just count it out quietly to myself, and you want to go at least 60 seconds. This unlocks the tension around your liver. It's very powerful, beyond what you would think. When I took this French osteopath technique called visceral manipulation many years ago, that training, you had to be really good at working on the visceral components, the connective tissue around the liver. And I learned how to do that. And then I learned this position from Sharon Giammatteo, physical therapist, PhD, and it unlocked that whole liver component. So the body will do a lot to protect vital organs, and if you have restrictions around your liver, it could cause your rib cage not to move very well. It could cause a restriction that stops your shoulder or neck from moving well. It could affect your hip. It could affect your detox. It could affect your digestion. So a very powerful position is this slouch, turn to the right 30 degrees, tilt to the left 35 degrees, and then we're combining it with this other technique where you touch very lightly on the belly button and the top of the sternum and direct a little pressure upwards towards the top of the head. And you hold it for about a minute, at least a minute. You can hold it longer. So hopefully that's been over a minute. We'll wait just a little more. I want you to be able to just follow along and do this with the video. Okay, and then come on back around. You're still touching very lightly on the belly button and the top of the sternum and directing a little pressure upwards. Now we're going to do the other side, the stomach side. So we're going to slouch like a teenager. We're going to turn to the left about 35 degrees. And then we're going to tilt to the right about 20 degrees. And now we're going to just hold that position for a minute. So I'll just kind of estimate a minute. And this works on the stomach. So restrictions around the stomach. You know, you can think of acid reflux and issues around digestion. But again, it affects the diaphragm. And if you have a restriction there, a tightness, you can be tugging on your shoulder, your neck, your hip, your back. If you got pain that's between your mid back and your low back, where the kidneys are, it can be affecting that. And that's why I like people to walk around, bend, move, jog before and after doing this exercise, this technique, because then you can see for yourself what changes. Even for your walking, are your arches different? Do you stand different? Are you taller? So if you want more information, Ralph at ralphhavens.com. I'm putting this on the blog, ralphhavens.com/blog. And we'll hold it for a little bit more just to make sure we have a full minute. You might even feel more relaxed, more at ease. When we work on this part of the body, the organs and the nervous system associated with the organs, the autonomic nervous system, you can feel a relaxation effect, less anxiety, less stress. And then come back around and then retest your walking, your bending, your moving. If you tested your running, test it before and after, 50-meter jog before, then do this, then 50-meter jog afterwards, and notice what's different. And I'm going to put the rest of the videos in the description and also on the blog, ralphhavens.com/blog. So reach out to me if you're in Bellingham. You can visit with me in person, and I will see you on the next video.